In 2007, over 9 million children ages 6 to 19 were reported to be overweight or obese, a number that has tripled since 1980. Dr. Anjali Jain of the Children's Hospital in Washington, D.C. specializes in childhood obesity and says there are a variety of factors contributing to this trend.
Children are not outside as much as they used to be. Certainly in terms of free play, going outside, having real physical activity during schools, those all seem to be on the downward trend. In terms of eating, portion sizes have gone up. They're drinking more sweetened beverages, drinking less milk. The content of what they're eating is probably much less healthy than it used to be.
According to a study by the Mayo Clinic, poverty and obesity go hand in hand. Parents with little income often lack the time and resources to make healthy eating and exercise a priority. Gallup polls find that Americans with lower incomes are more likely to say it is not easy to get affordable fresh fruits and vegetables in the area in which they live.
We do know it's more expensive to eat healthfully in this country. Whereas that used to probably not be true. It used to probably be the reverse, that meat was expensive and beans and rice weren't. But certainly fresh fruits and vegetables are pretty expensive. I think we're just at the cusp of starting to try to change that. A project that I've been peripherally involved in Ward 8, which has some of the highest rates of childhood obesity in the country, has been to have more fruits and vegetables available in some of the corner shops. And what we found actually is that you have to basically give it away.
But we're now finding that even parents with higher household incomes are finding it difficult to prioritize healthy eating and exercise. When Gallup asked Americans, "Did your child eat healthy all day yesterday?" only 14% of Americans who make less than $12,000 a year said no, while 22% of parents who make over $90,000 said no. We also see a similar pattern when we ask parents about their children's exercise habits. Very low-income parents reported higher levels of exercise versus high-income parents.
I would probably guess that a lot of that difference would be explained by perhaps wealthier, better educated parents having a better sense or higher ambitions for their children in terms of being healthy and being active and what they consider healthy enough. I looked at parents' views of some of these things, and this was a study of mostly overweight children and mostly overweight parents, and they were preschool age children, and every single parent thought their child was very active, sometimes too active. So what the meaning of the terms really can drive the answer.
While Dr. Jain's studies indicate that lower income respondents may be less informed on what exactly is enough exercise or healthy to eat, there is a perception amongst higher income families that time maintenance can cause a snag in the healthy lifestyles of their children. Steve and Lori Puckett have 2 daughters. They both work, live in a suburb of Washington, D.C., and aspire to maintain healthy lifestyles for their children.
I mean, we literally are juggling like, all right, what are you doing Friday? And we'll plan a couple days ahead as to who's going to get the kids from school, who's going to get them up for breakfast, who's going to collect dinner. I cook dinner just as much as Laurie does in this house. And we do a lot of grilling on a very regular basis. We'll have fruit, and we'll slice the fruit up as part of our daily meals, and we're big salad folks.
But they do admit that a packed schedule can at times make it difficult to maintain a healthy lifestyle.
Working parents probably have it a little bit more tough than parents or one that's able to stay home and have a little bit more time to cook.
Right.
And not have to rush around, not have to go through Wegmans or McDonald's.
The thing is, we're not perfect at this either.
Yeah.
I mean, there are days that we do skimp, right? And we say, hey, it might be hot dogs tonight or something quick.
I think probably out of all this, managing their diet and managing the exercise, the thing we don't do very well at all is sitting down, the 4 of us, and have dinner. Because
family dinners seem important for family health in general, and certainly for the well-being and the connectedness that people feel with each other. And all of those social things, I think, when they are lost or there's less of them, some of the more convenience foods and activities take over.
Even though the Pucketts are a healthy family, they do admit they have high standards for health. So you can't help but ask, how much a part of the weight issue is a need to educate both parents and children about healthy eating and exercise and applying it to their daily lives?
Because we probably know a lot more about what is and isn't healthy now than we ever did. And certainly, you know, now we have food labels that tell us better than we did in the past and stuff. So although education seems to make a difference, there is a big disconnect between knowing something and actually putting it into practice, or even knowing how to put it into practice. So education is important.